Hi, this is Dr. Omer Abbasi, and I'm giving a quick review for standardized patients about what to do with this case for Parkinson's disease. So, this is supposed to be a somewhat unfortunate situation. Individual who is in their 60s or 70s who starts developing symptoms including a tremor and slowing of their movements, which is a typical scenario seen in Parkinson's disease. In this video, I'm going to give you a few highlights that I want you to just be aware of and to make sure that you're portraying or emphasizing to the students. This is an unfortunate situation because students will be hearing a very sad story about how the movement impairment and the tremor have really impacted this individual's life. So the individual here basically lives a pretty full life and has recently retired from being a law professor for retired about a year ago. And the way this is kind of introduced to the student is that the patient feels that ever since they retired about a year ago, that they've been slowing down quite a bit. And in a way, they joke that they felt that their law practice was keeping them young. For a lot of people in society, if you have a tremor or some type of hand movement, most people would jump to Parkinson's disease or at least have that as a concern. Due to famous people like Michael J. Fox talking about this, it's not uncommon that somebody would self-diagnose themselves with Parkinson's disease or at least be concerned about it. For your character, you should keep in mind that your character kind of thinks it might be Parkinson's disease, but does not overtly say that to the student. So when the student's asking about symptoms, do not use the words Parkinson's disease or concerns about that. For you, it's like almost a taboo word, like you really don't want to say it out loud because you're worried it might be true if you even mention it. So that's the idea here. Just in case the student wonders why this wasn't bothering you before, how come you never brought it to anyone's attention? So basically in the last year, there's several symptoms that you've started experiencing. The chronology of these symptoms are important. So about a year ago when you first retired, you might have noticed some mild tremor or shaking. You might want to describe it as shaking and not necessarily a tremor, but mild shaking of your right hand. And a lot of times it'd be shaking when it was just resting on your lap. So that's usually the type of tremor people see in Parkinson's is a resting tremor. So if their hand is by their side or sitting on their lap, not doing anything, that's when they feel like it starts shaking. And sometimes it will go away when they're moving their hand. So that's what you noticed first. But as time went on, you started noticing the tremor started getting worse, and also was occurring now even with movement. So when you were trying to move your hands and doing anything, it seemed like your hand was getting shaky. On top of that, you started noticing your other hand started shaking, not as bad as your original hand. So the right hand still shakes more, but then the left hand started also shaking. So keep that in mind. You really want to focus on the fact that the right hand started shaking first, and then the left hand joined. But again, the right hand has always been worse than the left. Okay? So when you're describing these symptoms, that's really what you want to focus on. Over the span of the last year, and especially in the last 3 months, you've been noticing a worsening of your movements, that you feel more slowed down than you typically do. And then 1 month ago, you really started noticing that your walking has really slowed down. You can't seem to really catch up with your husband and your friends when you're going on walks. So this is a person who had a few different interests in their lives, and that's what's really being affected here. So the person really kind of loves to cook, considers themselves a foodie. They do love to travel, which is another thing that's really important. Let's see here. So they love to travel, and so what they've noticed is that and I was trying to make this about Florida, so I added some things to this case, but I wanted you to be somebody who enjoys making desserts, including key lime pie. But now what you're noticing is when you're trying to make the key lime pie, you can't really whip up the meringue to top the pie, and that's something that you used to pride yourself in, that you were able to whip it up quite well. And if you forget to say meringue, if you can't remember the word meringue, you can always say whipped cream, whichever one you want, but it requires that whipping motion. And Parkinson's would affect this because that requires a rapid movement of your wrist and arm. Well, actually, you should be using your wrist, but of your arm and hand to whip up the meringue or the whipped cream. And so now you can't really seem to catch the speed to really create the right texture for the cream. So that's something to really bring up as an issue. and something you used to pride yourself in was the key lime pie you were making. The other thing you've noticed is that when you and your husband go for walks after dinner, you're having a much harder time keeping up with them. And you can say that you've noticed that your steps are getting shorter. I would phrase it that way. So, the distance between one step and another seems to have shortened. So it takes you a lot more steps to walk as fast as your husband or your wife. And so that's how you're noticing that there's something going wrong there. Your handwriting may have also worsened. So you want to mention that when you're trying to write down recipes to keep, recollect for later or to keep for later, you notice that your handwriting has become really small and sometimes hard to read. To give you an example of this is typically the handwriting and how it changes. So this is somebody who is on Parkinson's medication and their handwriting is improving because of the medication, but then as the medication wears off, you can see it becomes much smaller and sometimes illegible when they're writing. So imagine this is happening to you, and when you're trying to write your recipes, when you go back to it, you really can't recall what the recipe even said, or you can't recall what you were writing because your handwriting has gotten bad. This is an example of what a tremor might look like. Actually, let's do it this way. So you can see this person's playing pool, and they're still able to play to some degree, but there's definitely a tremor, especially when they're focusing. You can see when this person is writing, their handwriting or their hands have a flicking movement. This is someone trying to button their shirt and having trouble with that because of their fine, or because of their hands. And that can be due to two things. It can be due to the tremor, but it can also be due to fine motor movement. So anything that requires fine motor movements becomes difficult. So when you're buttoning your shirt, when you're tying shoelaces, those things that seem kind of easy, because your fingers are slowed down and the tremor is there, it's really hard for you to make the movements necessary to make that happen. Double-clicking on a computer is another issue you have. So double-clicking requires a rapid movement of your finger, which you can't, with people with Parkinson's disease, will have that affected and they can't seem to do it as quickly. So that's another thing. These are the most important symptoms that I really want to make sure you are aware of and that you endorse with the students. This is the timeline, and again, it doesn't have to be exact. So as long as it was about a year ago, and then sometime between a year and now, over the span of times you've had a worsening of these symptoms, that's fine. It can be a little obscure because there isn't really an exact timeline for when these occur, but it should be a slow onset that's been getting worse over the past months. Otherwise, I would not use the word shuffle because that kind of gives it away. I would instead just say that you're taking smaller steps. It takes you a longer time to catch up with your husband or wife when you go for walks. That's the main thing. Let's see. Otherwise, the other thing you want to keep in mind are your medications. So you are on a multivitamin every night. You're taking metoprolol for blood pressure. Sertraline is an important one. So sertraline you've been taking for depression. The medication was given to you a few times from your 20s till now for episodes of depression. And that's very common that people take it while they're depressed, and then when they get better, they go off of it. So that's basically what you were doing. You've been on and off of it for a couple of times since your 20s. You don't have to say an exact number, but just say a couple. When you were last seen by your doctor, they told you to stay on the medication because you probably will need it for the rest of your life because of how many episodes you've had. To give you an idea, the minimum episodes you have to be told to be staying on antidepressants is about 3 episodes of depression. So you're on it now, and you've been on it at least for the last 5 years continuously. If you forget 5 years, that's okay, as long as it's more than 1 year. So you have to say like 2 years, or anywhere from 2 years to 5 years is fine. The thing this is supposed to do is make the student think about Zoloft causing the tremors, but the odds of that happening are very low, especially if you've been on it for so long and you've never had problems with tremors before. The other thing that a student might start thinking is that you're having another episode of depression with the onset of these symptoms. If they say that, you can tell them that you feel worried about the fact that they're having these symptoms and want to know what's going on, but in no way do you feel as depressed as you've had or as you have felt when you've had true clinical depression, which is how people would typically describe this, that I have felt much worse when I'm actually clinically depressed. I cry all the time, I don't sleep well, I don't get enjoyment out of things anymore, things like that. And you're not having any of those. You're more having anxiety or concern about what's going on with you medically. So if a student goes down that route, just use that to kind of quash that questioning so they don't go too far into the woods about a depression episode happening currently. Those are the main symptoms I really wanted you to be aware of. And if you have any questions, Dr. Proproda will be talking to you, but you can also ask me, or Dr. Proproda will ask me for you if you have any questions. So hopefully this video is a good way of helping you kind of rehearse this. You can review the video as many times as you need to remember some of these important components. Overall, this is supposed to be an unfortunate story that should make the students feel a little sad and feel worried about you, about how you're going to live your life, since a lot of it is going to be affected by the symptoms that you're experiencing. So when you're playing this character, I think having some concern or worry is going to be important. Oh, last but not least, when you are looking at the way you're supposed to present yourself, you can see here it says you should have a flat affect or flat facial expression. What this means is basically that your facial expression doesn't change substantially with the conversation. So you don't smile when the student is saying something funny, or if the student laughs, which a lot of students do in a nervous way. You shouldn't respond to that. There's no reactionary smile. There might be a small smirk. You could do that, but try if you can to keep your face still while you're speaking, and that might not feel very normal and easy to do. And so it's fine if it happens occasionally that you lose track of it. But if you can, if you're aware of it, try to keep your face still. Even if you laugh at something, trying to keep your facial movement still can really portray an affect that's typical of Parkinson's. The main question that's going to challenge the student is that this is really affecting your life. What is it, and can it be reversed? So keep that in mind. That's supposed to bring up some feelings of conflicted feelings in the student about having to break this news to you or talk to you about this. And actually, it shouldn't be their job to break the news to you that you have Parkinson's. They will have to do additional studies to really kind of confirm that. I would not press them to provide you with too much comfort, but I think this is a good question you can ask them and see what their response will be. And what you're really looking for is just an empathic response that may not have the total answer, but at least provides you with some validation about your feelings, and then also some empathy about your situation. That is about it. So I hope that was helpful, and let me know if you have any additional questions.